41. What is the nurse's first action for a patient with a new cough during chemotherapy for lung cancer? Answer: assess respiratory status and notify the provider. Rationale: a new cough may indicate disease progression or pneumonitis. Assessment and notification ensure timely evaluation per ONS guidelines. 42. What should the nurse teach a patient about managing chemotherapy-induced alopecia? Answer: use gentle hair care products and consider scalp cooling. Rationale: alopecia is a common chemotherapy side effect. Gentle products and scalp cooling minimize hair loss, per ONS supportive care guidelines. 43. What is the priority nursing action for a patient with a potassium level of 6.5 milliequivalent/L during chemotherapy? Answer: administer prescribed insulin and glucose and notify the provider. Rationale: hyperkalemia, greater than 6.0 milliequivalent/L, from tumor lysis syndrome is life-threatening. Insulin/glucose shifts potassium intracellularly, per ONS emergency guidelines. 44. What should the nurse assess in a patient receiving radiation for cervical cancer? Answer: assess for vaginal bleeding and pelvic pain. Rationale: cervical radiation causes mucosal irritation, leading to bleeding and pain. Assessment guides symptom management per NCCN cervical cancer guidelines. 45. What is the nurse's first action for a patient with suspected neutropenic fever? Answer: obtain blood cultures and administer prescribed antibiotics. Rationale: neutropenic fever indicates potential sepsis. Cultures identify the source, and antibiotics prevent progression, per ONS neutropenic fever protocols. 46. What should the nurse include in teaching for a patient starting immunotherapy for melanoma? Answer: report new or worsening symptoms like fatigue or cough. Rationale: immunotherapy can cause immune-related adverse events. Prompt reporting ensures early management, per NCCN melanoma guidelines. 47. What is the priority nursing intervention for a patient with a new onset of confusion in brain cancer? Answer: assess neurological status and prepare for corticosteroids. Rationale: confusion may indicate cerebral edema. Assessment and corticosteroids reduce swelling, per ONS brain cancer guidelines. 48. What should the nurse monitor in a patient receiving doxorubicin chemotherapy? Answer: monitor for cardiotoxicity and mucositis. Rationale: doxorubicin causes dose-dependent cardiotoxicity and mucositis. Monitoring heart function and oral health prevents complications, per ONS chemotherapy guidelines. 49. What is the nurse's first action for a patient with a new rash during immunotherapy? Answer: assess the rash and notify the provider. Rationale: immunotherapy-related rashes may indicate immune toxicity. Assessment and notification ensure timely management, per NCCN immunotherapy guidelines. 50. What should the nurse teach a patient about preventing skin infections during chemotherapy? Answer: keep skin clean and moisturized, and avoid cuts. Rationale: chemotherapy impairs skin integrity, increasing infection risk. Clean, moisturized skin and avoiding trauma prevent infections, per ONS supportive care guidelines. 51. What is the priority nursing action for a patient with a uric acid level of 10 milligrams per deciliter during chemotherapy? Answer: administer prescribed allopurinol and increase hydration. Rationale: hyperuricemia from tumor lysis syndrome risks renal failure. Allopurinol and hydration reduce uric acid levels, per NCCN guidelines. 52. What should the nurse assess in a patient with advanced lung cancer? Answer: assess for dyspnea and hemoptysis. Rationale: advanced lung cancer causes airway obstruction and vascular erosion, leading to dyspnea and hemoptysis. Assessment guides palliation, per NCCN lung cancer guidelines. 53. What is the nurse's first action when a patient reports severe fatigue during radiation therapy? Answer: assess fatigue severity and review medication list. Rationale: radiation-induced fatigue may be exacerbated by medications or anemia. Assessment guides interventions, per ONS supportive care guidelines. 54. What should the nurse include in teaching for a patient starting chemotherapy for ovarian cancer? Answer: report abdominal pain or bloating immediately. Rationale: ovarian cancer chemotherapy can cause complications like ascites. Prompt reporting ensures early detection, per NCCN Ovarian Cancer Guidelines. 55. What is the priority nursing intervention for a patient with suspected superior vena cava syndrome? Answer: administer prescribed oxygen and elevate the head of the bed. Rationale: superior vena cava syndrome causes hypoxia and edema. Oxygen and head elevation improve breathing, per ONS emergency guidelines. 56. What should the nurse monitor in a patient receiving rituximab for lymphoma? Answer: monitor for infusion reactions and infection. Rationale: rituximab can cause infusion reactions, e.g., fever and immunosuppression. Monitoring ensures safety, per NCCN lymphoma guidelines. 57. What is the nurse's first action for a patient with a new headache during brain radiation? Answer: assess neurological status and notify the provider. Rationale: headaches may indicate increased intracranial pressure. Assessment and notification ensure timely intervention, per ONS radiation guidelines. 58. What should the nurse teach a patient about managing chemotherapy-induced nausea? Answer: eat small, frequent meals and take antiemetics as prescribed. Rationale: small meals reduce gastric irritation and antiemetics prevent nausea, improving nutrition, per ONS supportive care guidelines. 59. What is the priority nursing action for a patient with a phosphorus level of 6 mg per deciliter during chemotherapy? Answer: administer prescribed phosphate binders and monitor renal function. Rationale: hyperphosphatemia from tumor lysis syndrome risks renal damage. Binders and monitoring prevent complications, per NCCN guidelines. 60. What should the nurse assess in a patient receiving chemotherapy for multiple myeloma? Answer: assess for bone pain and renal function. Rationale: multiple myeloma causes bone lesions and renal impairment. Assessment guides pain management and hydration, per NCCN myeloma guidelines. 61. What is the nurse's first action for a patient with a new rash during chemotherapy? Answer: assess the rash and withhold the medication until provider evaluation. Rationale: chemotherapy-related rashes may indicate toxicity. Assessment and withholding prevent worsening, per ONS guidelines. 62. What should the nurse include in teaching for a patient with a new leukemia diagnosis? Answer: discuss the importance of infection prevention measures. Rationale: leukemia causes immunosuppression, increasing infection risk. Teaching prevention improves outcomes, per ONS leukemia guidelines. 63. What is the priority nursing intervention for a patient with suspected spinal cord compression? Answer: immobilize the spine and notify the provider. Rationale: spinal cord compression risks paralysis. Immobilization and notification ensure rapid diagnosis and treatment, per ONS emergency guidelines. 64. What should the nurse monitor in a patient receiving carboplatin chemotherapy? Answer: monitor for thrombocytopenia and nephrotoxicity. Rationale: carboplatin causes bone marrow suppression and renal damage. Monitoring prevents complications, per ONS chemotherapy guidelines. 65. What is the nurse's first action for a patient with a new fever during radiation therapy? Answer: assess vital signs and notify the provider. Rationale: fever may indicate infection or disease progression. Assessment and notification ensure timely intervention, per ONS guidelines. 66. What should the nurse teach a patient about preventing infections after splenectomy for lymphoma? Answer: receive vaccinations and report fever immediately. Rationale: splenectomy increases infection risk. Vaccinations and prompt fever reporting prevent sepsis, per ONS lymphoma guidelines. 67. What is the priority nursing action for a patient with a new onset of shortness of breath in breast cancer? Answer: administer oxygen and notify the provider. Rationale: shortness of breath may indicate metastasis or pleural effusion. Oxygen and notification ensure rapid evaluation, per NCCN breast cancer guidelines. 68. What should the nurse assess in a patient receiving radiation for esophageal cancer? Answer: Assess for dysphagia and weight loss. Rationale: esophageal radiation causes mucosal damage, leading to swallowing difficulties and malnutrition. Assessment guides interventions per NCCN Esophageal Cancer Guidelines. 69. What is the nurse's first action for a patient with a new seizure during chemotherapy? Answer: ensure patient safety and administer prescribed anticonvulsants. Rationale: seizures may result from chemotherapy toxicity. Safety and anticonvulsants prevent injury per ONS emergency guidelines. 70. What should the nurse include in teaching for a patient starting palliative care for pancreatic cancer? Answer: discuss pain management and advance directives. Rationale: palliative care focuses on symptom relief and patient wishes. Pain management and advance directives improve quality of life per ONS palliative care guidelines. 71. What is the priority nursing intervention for a patient with a new onset of abdominal pain in colorectal cancer? Answer: assess pain characteristics and notify the provider. Rationale: abdominal pain may indicate obstruction or metastasis. Assessment and notification ensure timely diagnosis per NCCN colorectal cancer guidelines. 72. What should the nurse monitor in a patient receiving nivolumab for lung cancer? Answer: monitor for pneumonitis and colitis. Rationale: nivolumab, an immunotherapy, causes immune-related toxicities like pneumonitis and colitis. Monitoring ensures early detection per NCCN immunotherapy guidelines. 73. What is the nurse's first action for a patient with a new onset of leg swelling during chemotherapy? Answer: assess for deep vein thrombosis and notify the provider. Rationale: leg swelling may indicate DVT, a chemotherapy complication. Assessment and notification ensure rapid intervention per ONS guidelines. 74. What should the nurse teach a patient about managing chemotherapy-induced anemia? Answer: report fatigue or shortness of breath and eat iron-rich foods. Rationale: anemia causes hypoxia-related symptoms. Reporting and dietary iron improve hemoglobin per ONS supportive care guidelines. 75. What is the priority nursing action for a patient with a new onset of fever and chills and lymphoma? Answer: obtain blood cultures and administer prescribed antibiotics. Rationale: fever and chills indicate potential sepsis and lymphoma. Cultures and antibiotics prevent progression per ONS neutropenic fever protocols. 76. What should the nurse assess in a patient receiving chemotherapy for breast cancer? Answer: assess for lymphedema and skin changes. Rationale: breast cancer chemotherapy and surgery increase lymphedema and skin toxicity risks. Assessment guides management per NCCN breast cancer guidelines. 77. What is the nurse's first action for a patient with a new onset of chest pain during radiation therapy? Answer: assess vital signs and notify the provider. Rationale: chest pain may indicate radiation pneumonitis or cardiac complications. Assessment and notification ensure timely evaluation per ONS radiation guidelines. 78. What should the nurse include in teaching for a patient starting targeted therapy for leukemia? Answer: report signs of infection or unusual bleeding. Rationale: targeted therapies cause myelosuppression, increasing infection and bleeding risks. Prompt reporting ensures intervention per NCCN leukemia guidelines. 79. What is the priority nursing intervention for a patient with a new onset of confusion in multiple myeloma? Answer: assess for hypercalcemia and notify the provider. Rationale: confusion may indicate hypercalcemia, common in multiple myeloma. Assessment and notification ensure rapid treatment per NCCN myeloma guidelines. 80. What should the nurse monitor in a patient receiving radiation for head and neck cancer? Answer: monitor for xerostomia and nutritional status. Rationale: head and neck radiation causes dry mouth, xerostomia, and swallowing issues, affecting nutrition. Monitoring guides interventions per ONS radiation guidelines.